Hello, so today I'm going to talk about diseases that are quite common in older animals. The first one is hypothyroidism, which is more common in older cats. Signs and symptoms are things such as losing weight despite a good appetite, and often they can have a really good appetite or ravenous appetite. Drinking and weeing more, upset tummies often, frequent vomiting and diarrhea. And sometimes the coat can look a little bit more unkempt, a little bit scruffier than it used to do when they were younger. They can also get a high heart rate called tachycardia. Sometimes you can gain an awareness of this when you're holding them, and you can feel that the heart seems to be beating quite fast or faster than you're used to. Kidney disease is another really common thing in older cats, particularly as well. Signs and symptoms are things like drinking and weeing more, visiting the litter tray more frequently, losing weight, poor appetite, frequent vomiting, and lethargy as well. Another disease of older animals is diabetes. A lot of these symptoms can be similar to kidney disease as well. The main signs and symptoms are drinking more and weeing more, and sometimes this can be quite significant. You can notice them really going to the water bowl a lot more frequently, and you're having to fill the water bowl up a lot more often. They may also go to the litter tray more frequently as well, or need to go out to the toilet more at night as well. Or on walks, you'll notice that they're weeing a lot more frequently as well. They can have unexplained weight loss as well. Sometimes they can have a poor appetite too. If it progresses, they can also get vomiting and lethargy as well, so quietness too, and weight loss. Dental disease is a big disease in older animals, and this can be sometimes hard to see unless you're lifting the gum, lifting the lip, and having a little look at the teeth as well. But they can go off the food, or sometimes they can only eat wet food because dry food can hurt the teeth, and crunching on things or playing with harder toys, sometimes they do less as well because it may hurt the teeth. They may eat faster or slower sometimes as well if they're struggling, and sometimes you may notice that they're only eating on one side, so chewing on one side of the mouth. Sometimes they can salivate a little bit more with teeth pain as well. Generally become a little bit quieter as well, or not like you looking in the mouth, whereas used to they let you. Arthritis is another big one as well. Now, this can sometimes be harder to spot, but generally a slowing down of an older animal with age can be arthritis sometimes. So they may not walk for as long or as far. They may not run as often or be as playful as they used to. Sometimes they can be stiffer the next day after a longer walk or more bouncy exercise. They may be stiff and struggle getting up after rest, after lying down for a while. They may also be stiff going up and down the stairs or reluctant to jump up and down onto the sofa or onto the window ledge. For cats, they may take a little bit longer to decide to do it as well, so they'll look at the stair or the windowsill for longer than they used to, trying to decide if they want to jump up. They might be reluctant to play as well. Particularly in cats, they may not groom themselves as well, so their coats may get more mats, particularly near the back end, the tail, the hips, because they may struggle to reach those areas due to joint pain. You can notice a loss of muscle mass over the hips and the back legs as well, so they might just look thinner back legs as well. And then finally, unfortunately, cancers are more common in older pets as well. And it really does depend on the type of cancer and location for signs and symptoms. So this is not an exhaustive list, but things like signs and symptoms such as weight loss, quietness and lethargy, poor appetite, frequent vomiting or diarrhea, lumps and bumps as well. So how do we diagnose a lot of these things? So diabetes and kidney disease do share a lot of signs and symptoms, but they are both diagnosed on blood tests. You can also get an idea about diabetes, your vet can also get an idea about diabetes with urine samples as well. Hyperthyroidism is also diagnosed with blood tests as well. Your vet may get a suspicion of it on exam and recommend blood samples. Dental disease and arthritis, a vet will often diagnose from an examination, particularly for dental disease. They'll have a little look in the mouth. They may recommend dental x-rays to get a better idea of what your pet's teeth are actually like and the roots, and also for a better idea on tooth abscesses and infections as well. Dental x-rays can tell a lot. Arthritis, your vet may get suspicion from an exam, from feeling your animal, feeling the joints, feeling the muscle mass, but also from asking you detailed questions as well. Cancers, your vet may get a suspicion from exam and from what you're telling your vet, but they may have to do further investigations, for example, blood tests, imaging as well, so x-ray or ultrasound, or sometimes even referral as well. I'm going to do more detailed videos on each of these diseases for older animals. I hope that gave you a little overview and you found it informative. I hope you have a good rest of your day, and thank you for watching. Bye!